My name is Paul Warren, and I want to thank you so much for joining us today for cultural humility and motivational interviewing combined to engage and retain LGBTQIA people in care. The thing I'd like you to consider about the learning community conversation that we'll have today is we are going to look through the lens of cultural humility and consider how looking through that lens and using the practice of motivational interviewing can be an intentional and effective way of specifically engaging and retaining LGBTQIA people in care. Before we start to review the content in greater detail, a couple of disclaimers and housekeeping. One is that we are funded by the Substance Abuse and Mental Health Services Administration. SAMHSA does like us to make a disclaimer that they fund us to develop responsive and meaningful conversations and trainings for the substance use disorder services community. And they also like us to acknowledge that our responsive programming may not necessarily reflect their official views. Also, as we engage in this conversation today, it's important, I think, for all of us to be mindful of the fact that the words we use, the language, and the way we speak certainly has power. And in this learning community conversation, the primary guideline that we'd invite everybody to consider and to abide by is that we want to be using language that's affirming, that is culturally informed, and is advancing the use of evidence-based practices. As I said, my name is Paul Warren. I am currently a research project director at the New York State Psychiatric Institute, in addition to having the opportunity to be a senior staff trainer and curriculum developer for the Northeast and Caribbean Addiction Technology Transfer Center. And yes, I did say Caribbean, and that does mean that sometimes I am forced to go to Puerto Rico, St. Thomas, or St. Croix train. And I know you all, feel very bad for me about that. And I wish I could say that I was forced more often, but I am not. So I'm very happy to have the opportunity to be here with all of you today. And as laying the groundwork for this conversation, there are a few disclosures that I would like to make. One is that I am of European ancestry, and you may be able to see that from my photograph. I, as being somebody from European ancestry, experience and have white skin privilege. My sex at birth is male. I also have cisgender privilege, and basically what that means is that my gender identity and my sex at birth are the same. I identify as male. My pronouns are he, him, and his. I am monolingual. I only speak English. And I see that a colleague of mine that I know quite well has joined us. Welcome. Okay, somebody also types in that they are more than willing to help if I feel tired of going to the Caribbean. Thank you. I'm adding your list to about the other 500 people who have offered. So your name is on the list. I come from a family history of substance use and abuse. I should probably add that to the slide. And my father's side of the family, and in my immediate family. I was born in 1962. I will say no more than that. I will let you do the math, but it does work out to that I'm greater than 50 years alive. I, of course, have conscious and unconscious biases, and I am HIV negative. And I like to mention my HIV status because it is a way for me to just say briefly a little bit about my prior career. I began my social work career providing direct services to people living with HIV and AIDS. And I began that work in 1991. And of course, if you know anything about the HIV epidemic, and I'm sure many of you do, in 1991, HIV and AIDS manifested very differently than they do now. I worked for an organization that had most of the staff actually were HIV positive. And I was one of several HIV negative individuals who had the opportunity to work at that organization. And I mention that because that experience helped me to really understand within a work context that in that work setting, because I was HIV negative and my status was known, I had less power than the people who were HIV positive. And I think when we're talking about cultural humility, we really need to be thinking about power and privilege. And we could spend the whole remainder of our time together talking about power and privilege. And unfortunately, we don't have the time to do that. But I would ask you to consider, as somebody who's part of this learning community conversation, to reflect on the disclosures that you might make if you were facilitating this conversation, and what those disclosures would add up to in terms of how much power and privilege you may have in the society in our country today. So again, let that be the overarching framework that all of the rest of our conversation actually proceeds from. This is a 1-hour training conversation. Please be very clear, this is my own disclaimer, that it is not a substitute, and my colleague, who I respect tremendously and have had the opportunity to work with very closely, can probably testify to, is that a 1-hour training is not a substitute for a comprehensive overview and practice opportunities around motivational interviewing. And to keep in mind that to become proficient in the use of motivational interviewing, one really does need to receive informed feedback. So just keeping that in mind, that this is not an exhaustive conversation about MI. So we have 2 conversational goals. The first one is really to discuss and consider how the approach of cultural humility and the practices of motivational interviewing, when they're used together, how they can potentially engage and retain LGBTQIA people in care. And I want to pause here for a minute and just focus on the LGBTQIA. Lesbian, gay, bisexual, transgender, queer questioning, intersexed, and asexual. A colleague whom I respect tremendously, and I've had the opportunity to work with a number of times, who works in LA, had said one time during a training, he's an expert in LGBTQIA health and issues. He once said, at the time of that training, that there were probably 16 other letters that come after the A in LGBTQIA. So I like to mention that because I don't want anybody to feel that they're being left out. I stopped at the A simply because of room on a slide, and I knew that I would make the disclosure that there are probably 16 other letters that can come after this, and more letters are always being added. So just keeping in mind that the LGBTQIA plus 16 and maybe more community is evolving, is alive, is basically part of a society that continues to grow, change, define itself in new ways. So just keeping that in mind. And again, I want to make sure that that umbrella, we want to include everybody, even if those other 16 letters may not be there. The other thing I think that can be helpful to consider in terms of this conversation is we can make a choice to intentionally adopt a lens of cultural humility. And we can intentionally choose to employ the tools and the perspective of motivational interviewing. And in addition to being able to potentially better engage and retain LGBTQIA plus 16 and more individuals in care, the combination of this lens and these practices can have a profound influence on anybody that we work with who may have experienced trauma. Now, I'm going to ask you to type into the chat, and I'm going to ask you to type in from a percentage perspective, from 0% to 100%. Please type in the chat what percentage of the folks that you have the opportunity to provide services to, what percentage of those folks or individuals who come to your agency, because not everybody who's participating today may be a direct service provider. So people that you actually provide services to, or people who seek services at your agency that maybe you don't provide them, what percentage of those folks would you say have experienced trauma and are impacted by that trauma? So again, take a moment and just type in the chat the percentage, and I'll read. Somebody just typed in 100, okay, 75, 100, 100, 70, 70, 80, 75, 95, 97, I like how precise that is, 99, majority 98, 70, 40, 70%, 60%, excellent. So you can see, folks, that just about everybody except one person has 99%, not 75%. Everybody except one person has said significantly over 50% of the individuals that they either directly provide services to or receive services at their organization have been impacted by trauma. So again, cultural humility and motivational interviewing can, somebody just typed in 100%. Cultural humility and motivational interviewing, when they are intentionally combined, can impact, we just got another 100, can have a significant positive impact on interacting with folks, regardless of their sexual orientation or their gender identity, can help those individuals to engage and remain in care. So hopefully during the course of this conversation, you will consider your own relationship to cultural humility and also power and privilege. You will hopefully be able to describe how the tandem use of this lens and these practices can support a trauma-informed approach. And hopefully after this conversation, because hopefully this conversation is a continuation of conversations you're already having and thinking about, or it's a beginning to a conversation that maybe you hadn't thought of before. So hopefully, as we conclude this conversation, you'll be thinking about actions that you can take individually, organizationally, programmatically, actions that you can take, and I want to underline actions that you can take that would communicate to an LGBTQIA plus 16 person or LGBTQIA plus 16 communities that it is safe for them to be in your company and to be in your program and to be at your organization. And my hope is that's something you will continue after this conversation. So I'm going to ask again from the percentage perspective, because the question is really a closed question. You could answer it yes or no. Do you think about your safety? What I'm going to ask you to assess for yourself is within a 24-hour period, and let's just say randomly, within a 24-hour period, how often or what percentage of that time do you think about your safety? And again, that can be from 0% of the time to 100% of the time. And I'm asking you to just assess generally in a 24-hour period, what percentage of that time do you think that you have conscious thoughts about your safety? And again, we have over 85 people participating in this conversation now. So please type in the chat what percentage you think about your own safety. Okay, so let me read some of these. 50%, 10%, 25%, 10%, 65%, 80% of the time, 25% of the time, 30, 48% of the time, 10% of the time, 5%, 50% in this pandemic, and thank you for qualifying that, 75% of the time, 42% of the time, 100% of the time, 35% of the time, 10% of the time. Excellent. So you can clearly see, folks, that we have a wide range of the people who are part of our learning community who are thinking about their safety 50% or more of the time. Now, this is a rhetorical question. You don't need to type this in the chat, but what I'm going to ask you to consider is what are the factors, and one of our colleagues mentioned one because they qualified it during this pandemic or in this pandemic, they're thinking about their safety more. What I'd like you to think about, again, for yourself, and you don't need to put this in the chat, is what are the factors that cause you to think about your safety that percentage of the time? Some people have identified that it could be their sex at birth. Some people have identified in the past that it could be their race. Some people have identified it could be the neighborhood that they live in. So I'm going to ask you, and again, this is rhetorical, you're just asking this of yourself, is what are the factors that cause you to think about your safety within that 24-hour period of time? And you'll also notice that when I asked you that percentage question, I said that you consciously think about your safety. What I'd like to add here is for some LGBTQIA individuals, they are also thinking about their safety on an unconscious level as well. So there are impacts, health, emotional, relational impacts for needing on a conscious and an unconscious level to be focused on one's safety. So again, you're just rhetorically asking yourself what those factors are. And you can also consider what is it that helps you to feel safe. So I like to ask that question because it's important to know that what helps one person feel safe may not help another person to feel safe. And there are ways of interacting that can either contribute to someone feeling safe or cause them to not feel safe. Now, somebody just typed something in the chat and I just want to make sure. The election may cause some zealots to come out. Yes, and that could impact one's feeling of safety. One thing that helps somebody feel safe is working from home. And again, thank you for putting these in. We're living in a time that people are getting assaulted. Yes, that's very true. For no reason. There's a lot of hate in the atmosphere right now. Absolutely. Absolutely. So for extra credit, does anybody know what this is a picture of? And if you know what this is a picture of, feel free to type it in the chat. And then I'll explain why I'm showing you this picture. Somebody just typed in, people are getting more angry. And people are typing in that it is the Grand Canyon, and that is absolutely true. Somebody wrote in, the time of day I am out, if there are a lot of people out, impacts on how safe they feel. Yes, it is the Grand Canyon. The reason I wanted to share this picture with you is A, I took this picture with my telephone, and B, sometimes when I'm feeling anxious, I think about the Grand Canyon. I've had the great privilege of being there 11 times and hiking and camping there. And it's just a place that helps me to feel safe. And I'll give you kind of, an interesting example of that, which I think, is perhaps another disclosure on my part. You may recall, some of you may recall that when we went from the year 1999 to 2000, there was a lot of concern about what was going to happen, and were computers around the globe going to explode, and would the economy fall apart? And I thought to myself, where do I want to be if the world is going to end on January 1st in 2000? And I actually spent New Year's Eve at the Grand Canyon because that's where I felt I wanted to be. So again, I just want us to be thinking about what causes us to think about our safety and what also helps us to feel safe. So again, these are just questions I'd like us to consider as we start to make a transition into cultural humility. I originally had the opportunity to formulate and deliver this conversation. I was invited to present at a conference in Pittsburgh, and it was an LGBTQIA conference with that year a specific focus on transgender health. And the day before I was supposed to give my talk, I attended another talk where somebody stood up and they said their name, and then they said, "I'm an expert in cultural competence." And something about that statement really, I don't know, it had an impact on me. So I really thought about it, and I thought about it because the lens of cultural humility, one of the primary tenets of it is that we can never be an expert in cultural competence. What we can do is we can look to the horizon and we can aim toward cultural competence, but we will never achieve it. And the perspective of cultural humility is that our journey toward cultural competence is lifelong and involves intentional openness and actions centered on learning. So the sheer fact that you're participating in this learning community conversation is part of your journey toward that horizon, that aspirational goal of cultural competence. Again, from a cultural humility perspective, we will never achieve that goal. There's only one place that we can be an expert in cultural competence, and that's with ourselves. So having said that, here is sort of a concise version of what the cultural humility perspective actually is. And there are a couple of things as you read this, I'd like to point out to you. And I've already said this, but it's a lifelong process of learning and self-examination, self-reflection, refinement of one's own awareness, meaning that there are things that we may be aware of, and there are clearly, and I said I carry unconscious bias. Part of my work toward that horizon of cultural competence is attaining knowledge, interacting with other people, being open to other people's feedback, so I can refine my own awareness about what my blind spots may be, what my bias may be. Also, cultural humility is focused on the idea of the interplay of power and privilege and social contexts. It acknowledges that power and privilege play out, and they play out within social contexts. So you think about your office, and again, many of you are probably working from home, and your office is actually now a Zoom conversation with somebody. But think about how power and privilege play out in that context. And I'm going to pause here and ask you a question, and please type this into the chat. Your take on this. And there's no right answer. I'm asking you for your take. Yes, and somebody just points out also access to technology, because that is a degree of power and privilege as well. And we're certainly finding that out during this pandemic, because as if you're listening to the news, you may know there are whole huge groups of people throughout New York City and New York State and the country who don't have access to the hardware, software, bandwidth that they need in order to participate in remote learning. Talk about power and privilege. It's a great example. So I'm going to ask you this question, and again, trust your gut on this. It's your gut response. Why did I make the disclosures that I made at the beginning of our conversation? So I'm asking you to think about that and just reflect on that, and whatever your thoughts are about that, just put it into the chat. You made those disclosures because. So again, I'm asking you to share your thoughts about that, and we do have over 90 people participating in our conversation. And again, I'll try and read as many of them as I can. Okay. Somebody typed in, they are related to power positions in our society due to assumptions people may have. It was my choice, absolutely. And again, any other thoughts about why I shared those disclosures? Let's see. Okay, due to assumptions people may have, I said that. To connect with participants, to provide a context. Somebody put in a quote, we delight in the beauty of the butterfly, but rarely admit the changes it has gone through to achieve that beauty. And it's a quote by Maya Angelou, thank you. And somebody typed in, you told us who you are, okay? You made those disclosures because you chose to give us insight into what your experience may be. Excellent, thank you. They can influence your work, absolutely, and I will qualify that and say they do influence my work. There's no way they really couldn't. Clarify the objectives of the training by providing, and I think it's going to say providing a personal example, yes. Openness is a beautiful thing, makes everyone comfortable. Okay, I hope that was the impact. It is partly about creating safe environment for all, and that was as a question, and I would say yes, it is. Connecting with people, identifying my social location, self-acknowledging the privileges or disadvantages of your experience, absolutely. So we can have a picture, in quotes, of you, absolutely. You made those disclosures because you wanted to set a level of awareness and comfort before you began the conversation. The acknowledgement of your privilege, absolutely. Demonstrate some of the realms of power, practicing cultural humility. Yes, personal example and being transparent. We all have to be aware of our privilege and biases to serve others. Absolutely. Absolutely. Thank you so much, everybody. Thanks for sharing your insights on that. So this is the invitation of cultural humility. We are invited to engage in a process of self-reflection and self-critique, meaning that as we look at ourselves, we may realize, oh, I didn't realize it, but I have this particular bias, or upon reflecting on my interaction with that staff, colleague, or that client, I'm having those feelings because of. Also, we're invited to bring into check the power imbalances by using patient-focused interviewing and care. And we could also say client-centered interviewing and care. And we could also say being in a collaborative partnership. So the reality is if somebody is sitting across from us and we are providing services to them, we inherently have more power. And that's simply because of our location at that particular moment. We may not be factoring in skin color, education level, sex at birth, gender expression. All those things also add to power imbalances. We're also invited by cultural humility to not assume that one size fits all, and looking at cultural dimensions, meaning that if somebody comes to you and they identify as gender queer, that is one cultural dimension of their gender identity. It is not their whole experience. So just keeping that in mind, that's the invitation. While we're engaging using this lens, we are invited and asked to recognize and maintain that we're not any better than our clients. And they are the experts of their lives and their communities. And if we are open to learning about that, we can. Also, that we want to be in collaborative partnerships, non-paternalistic. We're not saving this person. We're not taking care of this person. We're not this person's parents. And we want to also have non-paternalistic partnerships with communities as well. So the skills. One of the skills is constantly assessing and reminding oneself and checking in with oneself that we have the values that we have, and those are our values. They do not equal the norm. They're simply our values. And we want to be aware that the values of the person sitting across from us may be very different than our own. And one of the skills, and this is probably for cultural humility or for any human service interaction, is the willingness and the ability to remain open to learning. Again, these are some of the invitation, the practices, and the skills that can help manifest this lens of cultural humility. Now, I'm going to pause here at our basics and ask you to weigh in on something. And again, there's no right or wrong here. Somebody typed in, how dangerous to believe that we are culturally competent. Yes, that's true. Absolutely, you could say person-centered care. Another person typed that in. That's very true. So what I'm going to ask you to focus on at this particular moment, and again, there's no right or wrong here, but in terms of what we've discussed, what I've reviewed so far about cultural humility, just take a moment and trust your gut on this. Don't think about it too much. What stands out to you most about what you've heard, what I've said, what other people have written in? What stands out to you most about cultural humility? And again, there's no right or wrong. You're participating in our learning community conversation. So please take a moment and just jot down, don't even worry about spelling, just jot down, it's not ethnocentric. Say yes to cultural humility. Yeah, say yes. And again, it's just whatever stands out to you. We are not expert, okay? And I know typing takes time. It's not about you. Clients are the expert of their own lives. That has always stood out for me when I learned it in grad school, absolutely. Thank you for reminding us all of that. And that is very true. You could never become professional. Now it's interesting, let's qualify that. You could never become, quote unquote, culturally competent. Doesn't mean you're not professional, you're just not, quote unquote, stamped culturally competent. We all have biases and are only knowing about ourselves. How many people are working with vulnerable populations? Okay. We are always learning, absolutely. There are many aspects to know about people. Oop, they're coming in fast and furious. I just want to make sure that I finish that. There are many aspects to know about people besides what we can see with the eyes, and how much someone knows about you depends on how much you choose to disclose. Yes, and as many of you had said, I chose to make disclosures in the beginning. We must respect people for who they are. Those are the lessons of our work. We must respect people. Okay. We are always working with partial knowledge. That's a very interesting point, because let's face it, I made some disclosures to you, but there are other things about me that you don't know, and maybe you would only know if we were sitting across from each other. Encourages a respectful attitude toward individuals of other cultures. The only way to learn about how to work with someone is to ask them what works. I like that. I like the flow of that sentence. I'm going to read it again. The only way to learn about how to work with someone is to ask them what works, and talk about a perspective that does not focus on one size fits all. We are most mindful about ourselves. Treat others the way I want to be treated, always, no exceptions. Respect, encourage, and support. Ask how we can help. Wonderful. Thank you so much for reflecting on this. Let's come back for a moment to basics. And I'm going to ask you to kind of weigh in on this, in the sense that if you think that these four, safety, welcome, respect, and trust, are the basics, if you think that that's an accurate assessment of what the basics are, what every one of us is shooting for, safety, welcome, respect, trust, if you think that's accurate and you think those are the basics, type in an A. If you think that there's something that's missing from these basics, type that in, because this list can get bigger. So again, I'm asking you to weigh in. Do you think that safety, welcome, respect, and trust cover the basics? Or do you think there's something missing, and what is that? Let's see. People have typed in a lot of A's. Somebody typed in dignity. So, yes, absolutely. And somebody typed in understanding. Okay, excellent. And again, as you think about this, safety, welcome, respect, trust, dignity, understanding, basics. I also like to connect these basics to the ability to engage somebody in care. If we can communicate to somebody non-verbally and verbally that they are safe, they're welcome, they're respected, they can trust, we will seek to understand them, we will respect their dignity. If we can communicate that to individuals, it's much more likely that they're going to engage with us, with the service, with the program, with the organization. And if we can maintain those basics, it's much more likely, I'm not saying it's foolproof, but I'm saying it's much more likely that they will then also be retained in care. So keeping in mind those basics. And I want to review for just one quick moment. Primary idea number one, reflecting on our own power and privilege. That's a takeaway that I hope everybody will walk away with. And that's individual work. That's part of that self-critique, that self-reflection. Key message number two, what we are shooting for and hoping to achieve and maintain are these basics. Safety, welcome, respect, trust, understanding, dignity. So power and privilege, basics. Let's make a transition into talking a little bit about motivational interviewing. And again, folks, please remember, somebody added empowerment, another person added vulnerability, which would, I think, trust. In order for somebody to be vulnerable, they would need to trust. Open-mindedness, wonderful. Thank you so much for adding to that list. Another empowerment, understanding, open-mindedness, acceptance, flexibility. Yes, and they do have to feel safe. That's absolutely true. And again, that's one of our basics. So if you can, and I'm not sure how good the image is on your device, but can you tell what this is a picture of? And if you can tell what this is a picture of, go ahead and type it in the chat. And again, it is definitely gold bars. It is gold. And I like to associate motivational interviewing with gold because it truly can be of very, very rich and powerful value. So keeping in mind, and you'll notice, we talked about the lens of cultural humility. Well, I think the beautiful thing about motivational interviewing is it kind of operationalizes the idea of cultural humility into an actual practice of how we can interact with people, the work we're doing with that individual, and the tools we can use when we're working with that individual, that group, that community. So first and foremost, it's a client-centered and worker-guided conversation. It's also focused on a collaboratively identified change goal, and the ambivalence about that change goal is explored, and the unique motivations, and this is also where cultural humility helps, because we could make a lot of assumptions about why somebody might be considering change, but really all that matters, especially from the perspective of motivational interviewing, is what are their desires about this change? What are their thoughts about their ability to make this change? What are their reasons for making this change, and why do they think they need to make this change? So in MI, we want to help, yes, darn CATS, absolutely. And CATS is commitment, activation, and taking steps. And those are forms of change talk. And I often say change talk is the gold of motivational interviewing. So again, this is not an exhaustive course on motivational interviewing. And if you are interested in that, we do often have learning community conversations that go more in depth into MI. So client-centered, it's a worker-guided conversation. There's an identified behavioral change goal, and the ambivalence about that change goal is explored, and the motivations to consider that change, to make that change, to move in the direction of that change are identified and they're discussed. Related to my disclaimer earlier, in order to truly become proficient in the use of motivational interviewing and to maximize sort of the proven potential of the practice, you need to practice it and you need to receive feedback on your practice. And there are ways that, that you can have that experience. So as we talk about motivational interviewing, one of the things to consider is something in MI called MI Spirit. And MI Spirit really gives us guidance about how we want to be when we're across from any individual person, group, or community. It guides us as individuals how we want to be. And again, you'll notice such a wonderful, rich overlap with cultural humility. Somebody types in, it is the intention behind what we do. Say a little more about that. I'm not exactly sure the full meaning of what that is. So if you can elaborate, please do. So MI guides us about how we are with the individual. And MI, first and foremost, requires a collaborative partnership between the person providing services and the person seeking services. They need to be collaborative partners. They need to each have power. And yes, you may have a degree. Yes, you may have lived experience. Yes, you may be employed by a particular organization. And you can still be a collaborative partner and respect the power that that individual has and maintain a partnership as opposed to an authoritarian, paternalistic, I'm here to help you, save you attitude. So again, MI really invites us to be in a collaborative partnership. It also, MI Spirit, which is again one of our guiding principles, asks us to accept that the person who is sitting across from us, the community, the group, has value as a human being no matter what they've done or no matter what they're doing. Now let me qualify that or clarify it. That does not mean that we're condoning what they've done or what they're doing. It simply means that we accept that that person as a human being has absolute worth. We also want to approach with compassion, meaning we want to stay open to feeling compassionate and empathetic toward this person. Somebody types in, the spirit is the intention behind what we do. You can't do MI with a person without the spirit of MI. I would agree with that, and thank you for elaborating on that. I would agree with that because you need to be guided by this MI spirit. And let's be clear about this. We're not talking about something new agey here. We're not talking about something that's just an idea. Partnership can be operationalized. We can speak to somebody, engage with them in a way that we are communicating that we are a partner. We can also, acceptance is not just an idea, it's a set of behaviors, as is compassion. We want to put the person's welfare above our own agenda. Not only the spirit, but the motivation. Yes, and we do want to be asking ourselves, what's our motivation for working with this person? And again, we may have an agenda, the program may have an agenda, the organization may have an agenda, but we want to be aware of those and the impact of those on the conversation. And then the last part of MI Spirit, which again, I think has such a strong relationship with cultural humility, is acknowledging that the person sitting across from us is the one who has the best answers about what might be the next action for them to take, what they think the solution might be, what their motivation may be to take an action or not take an action. And again, you'll notice that partnership, acceptance, compassion, and evocation spells pace. So you can always remember MI Spirit, how we are with the person, by that acronym of PACE. The tools. I have to say a word about the tools. The tools of MI are probably the rock stars, the Queen, I like to say, the We Will Rock You band Queen. The tools of MI are probably the rock stars of MI. If you say to somebody, oh, what do you know about MI? They'll say, oh, ORS, open-ended questions, affirmations, reflections, and summaries. I have a shockingly frightening disclosure to make in regard to this, and I'm being facetious, I'm kidding. The tools of MI do not equal the practice of MI. Just because somebody uses an open-ended question, makes an affirmation, does a reflection, or does a summary does not equal the practice of motivational interviewing. What it means is that that person asked an open-ended question, and that's a great thing. They may have done an affirmation. That's a great thing. They may have done a reflection. That's a great thing. They may have done a summary. That could also be a great thing. It does not mean because they did that, they're practicing motivational interviewing. It means they are using an open-ended question, an affirmation, a reflection, or a summary. What makes MI is that the conversation is focused on a behavioral change goal or a target behavior, that the worker is guiding the conversation, and they are seeking to explore and resolve the ambivalence that the person has about that particular change goal, and they're seeking to draw out that individual's motivation to consider and make that change. So Bill Miller and Stephen Rolnick, the creators of MI, did not invent the open-ended question, affirmations, reflections, and summaries. They did come up with a great way to remember them though, ORs. So just keeping that in mind, those are the tools we use when we are engaging in conversations with folks, whether we are practicing motivational interviewing intentionally or we're simply engaged in a conversation. And these tools will help us to interact from the lens of cultural humility. Having said that, this is the audience participation section of the training. And it's done on the honor system because I can't see you and you can't see me. But what I'm going to ask you to do at this particular moment is point or indicate in some way your eyes, your ears, your heart, and your gut. I will say it again, and point along with me or touch those areas if you feel comfortable doing that. Your eyes, your ears, your heart, and your gut. Now, if you actually pointed or touched those areas, type in a Y in the chat. And I just typed in a Y because I just did. If you felt a little, maybe embarrassed or unwilling or unsure, just type in an N if you didn't. And that's okay, because you can choose how the level of your participation during this conversation. The thing I'd like you to take away from that though, and hopefully because you did that physical gesture, you will never forget it, is when we are using the lens of cultural humility and we are approaching with an MI spirit and using the tools from MI, and maybe actually practicing MI specifically because we have a behavioral change goal that there's ambivalence about, and we're guiding the conversation to explore and resolve ambivalence and to build motivation, we want to make sure that we are watching what's going on. In addition to watching, we want to be trusting our gut about what we feel is going on. We want to be listening with our ears to what is being said and also what is not being said. And we also want to be listening with our heart. So we are asked when we engage in this practice through this lens to be listening on all four of those levels: eyes, ears, heart, and gut. The beauty of being able to do that is twofold. One, those are skills. We can all learn how to do that on all four levels simultaneously. So it's attainable for everybody. The other is that by doing that, we can seek to deeply understand where this individual is coming from. Somebody types in, the more righteous, the more the gut is heard and felt. Okay. Somebody also writes in, plus those all depend on the brain. Say a little more about that, about them depending on the brain. Meaning, I think I understand your meaning, but please, I'll let you clarify. So again, we're trying to operate on all four of those levels simultaneously. And I throw out to you just in the last few minutes that we have together that just as an experiment for yourself today, when you're in a conversation with somebody, check in with your eyes about what you're seeing. Check in with your gut with what you're feeling. Check in with your ears about what you're hearing, and check in with your heart about what you're feeling. Somebody wrote in, the eyes, ears, gut, and heart are nothing without the brain. Very true. Very true. Yes, because it's all related. So again, keep in mind, folks, we want to be open to what we're receiving on all four of those levels. So in the last couple of moments, for extra credit, can anybody identify what classic animated film this image is from? And if you can, type it in. Yes. Wow, that came in really fast. It is, another person just came in really fast. It is Snow White. It certainly is. And it's the mirror, mirror on the wall. So the thought I'd like to leave you with, and I'm hopeful that we'll get to pick this conversation up again going forward, but the thought I'd like to leave you with at this particular moment is consider always asking yourself, are you safe? And let me qualify what I mean by that. Are you safe for that LGBTQIA plus 16 plus more person to be sitting across from? That is a question that you can ask yourself, and it's a question you can ask yourself every single time